Hi there, my name is Leslie Green, and I'm the Director of Education for Hanger Clinics, and I'm here with Dr. Jain.
Yeah, I'm Dr. Krishna Jain. I'm a vascular surgeon. I'm the Chief Medical Officer for Apex Health Network, and we help people opening limb preservation centers.
Dr. Jain, you and I had started a conversation a couple of days ago at the conference about wound care. And I think that's an area that most patients don't want to learn about, but I know how critical it is, that they come in for treatment. And I wonder if you'll just talk a little bit about your experience helping patients understand wounds and the wound treatment.
Yeah, so it's not only the patients, even the doctors don't understand wound care. So I'm a vascular surgeon, so all my life I have been providing perfusion, but never learned enough about wound care. So then ultimately I hooked up with people who are experts in wound care. And the podiatrists really do a phenomenal job. You know, in our surgical training, we really do not get that much experience in the appropriate wound care. And when the patients come, we keep managing them on a day-to-day basis. But I think they need more expertise, which goes beyond the training of a general surgeon or a vascular surgeon, because we usually get those patients first in the office, and orthopedic surgeons too. So they need to go to a proper wound care center, which is dedicated to providing the best possible care, evidence-based care for these patients, and educate patients.
So when you say wound care center, then you say proper wound care center.
Yes.
Obviously, there's a difference between the two entities.
Yes.
And I heard you deliver a talk on what you consider the optimal care at a wound center. Can you talk a little bit about what you have designed?
Yes. So what we need to have protocol. We need to have protocol-driven care in any wound care center. When a patient comes in, you know, if he has a diabetic wound, the commonest wound we see in wound care centers is diabetic foot ulcers, which results in the maximum amputation. So there needs to be a protocol. How do you examine the wound? You make sure that you take cultures, make sure you check circulation, extremely important. Many of the wounds, many patients end up with above-knee amputations, never ever having done a non-invasive exam of the extremity to see if the circulation is adequate.
Right.
People don't get adequate culture. Not only that, in a proper limb preservation center, you need to have multi-specialty care. For example, you need to have an infectious disease doctor who's an expert, who's not in your beck and call, but the patient be able to see them in 24 hours, 48 hours.
Right.
But if you go beyond a week, they get multi-organism infection, and despite best care may lose their leg. So basically, when we talk about a proper wound care center, we talk about people who are trained to look at these wounds, whether they can be doctors, podiatrists, there could be advanced nurses, could be PAs who are well trained in that, and they need to know the techniques for proper debridement. You know, so they need to debride the wound completely, get rid of all the dead tissues, and then if they need perfusion, they need perfusion. Sometimes they need hyperbaric oxygen therapy, which are very defined indications by Medicare, but you can do that. So all that is a part of a proper wound care. When we talk some wound care, people do wound care in the office and sometimes have wound care centers, but they just do it without really looking at the results. You need to be result driven. You have to have good results.
And I think that's something that I find fascinating, because when I think about patients who are in the hospital, and that oftentimes is a very quick look at the wound and a quick treatment of the wound, and then the patient's released home. What are your thoughts about interdisciplinary care between the clinics that you're talking about and setting up with all of the components and the hospitals? Do you do training to the hospitals?
Yes, absolutely. We work with the caseworkers. That's where you start when you have a caseworker patient is being discharged or whatever. Then we work with the skilled nursing homes. We work with all these people and train them. And then when the patient comes to us, we educate the patient. We have to, because we can do everything good in the center,
Right.
but if the patient and the family are not educated well,
Right.
Then they can go home and do the wrong thing and get into trouble. And so not only that, there's a huge component of psychological effects too.
Absolutely.
Because these people need to know that they will heal, everything being done. And so we have to work with their depression. Sometimes they're very, very depressed. So again, it goes back to protocol driven. Not only that, you have to follow the wound. So we use EMRs, which look at the wound, take a picture of the wound, and then we follow them on a weekly basis, how the wound is improving. Because maybe somebody else saw the patient last week, Now somebody else is seeing the patient the next week.
Right.
So they have some reference frame as to how it looked last week.
Right.
So all these are part of the whole training program which we have built, and then again teach people how to do proper debridement.
Exactly.
Yeah.
And I'm thrilled that you bring up the home component.
Yeah.
Because oftentimes, you're right, families do go home and have to do the care of the wound in home. Talk to me a little bit. You brought up the mental health piece. And when I think about wound care that I've had to do for family members and the anxiety that produces for myself, let alone an individual who's looking at the wound, will you talk to me a little bit about what you think is appropriate education and resource support for family and friends? Because we've talked that 30% self-report mental health issues that have wounds from either the equipment, the duration, the odor, and they isolate. If you could dream resources, education, and support for patients and family members, what would you put into place?
Well, I think again, this is an area which is not well understood.
Yeah.
It is identified. Your company you have identified it. So it is identified, but we don't know the solutions right now. But some of the things we could do is, number one, first have some sort of a questionnaire that then the patient comes in, they fill it, and they can fill it on every 2 weekly basis, so we can follow what their mental makeup is. And again, if we do that, then if we find people, then we can, once we know the issue, then we can find the resources. Unfortunately, with the current healthcare system, mental health care does not get the priority it needs.
Right.
So they don't
Right.
get the support. So, but it is possible that if we identify them, we can get in touch with the caseworkers or social workers. Social workers are phenomenal in terms of working as a whole team, working with you. So they can play a very integral role. Not only that, for social workers and all, to let the doctors know or the providers know in the wound care clinic this person is having these issues, then we can be more supportive of that. If we don't know, we can't take care of it. And again, the time is limited. We have X number of patients. So the more you know, the more chances that you can address it. Yeah.
And I just want to thank you for your vision. Instead of the reactive and episodic treatment, what I hear from you is such a birth of a notion of interdisciplinary continuums. And if that can incorporate wound care, imagine the lives that you will change.
But we appreciate that, and companies like yours too can be very helpful because you see a lot of those people, and I have worked with Hanger for maybe 30 years or longer, so maybe longer. So I mean, it has to be collaborative.
It does.
It has to be, that's the
Absolutely.
only way it works.
Absolutely.
We are all in for doing the same purpose, taking care of
Absolutely.
patients.
Absolutely.
Thank you.
What a pleasure. Thank you so much.
Thank you.
Have a
Thank you
great
for talking to me.
Thanks.